This is William Sauve, spelled Sauve, and I am making a recording for a success story for the carnivore diet as requested by Dr. Sean Baker. I am 45 years old. I'm a practicing psychiatrist. I started the ketogenic diet along with my wife, actually at her request because she wanted to try it approximately a year ago, so starting in July of 2018. After several months on that, we shifted over to the carnivore diet. Not to flatter you too much, Dr. Baker, but inspired for the most part by your videos. Namely, both of us have been competitive rowers, my wife being a competitive rower in college, and I continue to be a competitive rower here at the club at Richmond. So we switched over to the carnivore diet. Overall, the results have been this. Since starting a ketogenic diet and then moving into the carnivore diet, I probably lost a net of about 30 pounds. More importantly, I lost between 3 and 4 inches off my waist. When I was 19 years old in college, my waist was about a 34 with a 34 inseam. By my 40th birthday, I was really hanging around about a 36, and actually sometimes the 36 was sort of kidding myself. And within a few weeks of the ketogenic diet, and then later moving into the carnivore diet, I was back down to a 34 waist, actually a little bit less than that because all my new 34 pants are loose. So it's probably closer to a 33 waist. More importantly, I've been lifting weights, and I would say that I'm the strongest I've been at least since I was 22 years old. I've squatted more weight before, but now I'm really enjoying squatting consistently, deadlifting consistently. I also was starting to have some chronic knee pain to the point that I'd stopped running entirely. I've never considered myself a runner, but about 4 or 5 years ago, I decided I wasn't going to run anymore because my knees hurt all the time, and I could only be without knee pain if I was mostly doing impact-free exercise like rowing. Since starting the ketogenic diet and then moving into the carnivore diet like what we do now, I've found that the knee pain completely went away. And now I can run whenever I feel like it. So I regularly run for 10, 15 minutes for warm-ups before I lift weights. And every once in a while, if the weather's really nice, so I go out running for 3 or 4 miles, and I haven't had a problem with any kind of knee pain in over a year. It's a little difficult otherwise to say what the benefits have been because I was not officially sick before. So I made that little quibble about the survey because I was on no real prescription medications before, and I'm not on any prescriptions now. And I had no problems that were diagnosable previous to the diet. My lipid panel was fine. All my other measures were fine. But since then, I have had my fasting insulin tested, and it's down around a 1. And so I almost certainly had insulin resistance before, what with the expansion of my waist, and that's clearly gone away.